Today, we're going to tell you a bit about Claudia. She's 30 years old and lives in a busy neighborhood of a big city in Brazil. Claudia is married and has 2 children. Like so many women, she juggles work, family, house chores, and monthly bills. Claudia has diabetes. She uses the public health system and has regular checkups at her local clinic. But one day, even though her test results looked fine, something felt off. Her blood pressure was high. She told the doctor she'd been feeling very anxious, insomnia, body aches, a constant tightness in her chest. In the following visits, new layers emerged. She talked about fights at home, a husband who drank too much, harsh words, yelling. In another consultation, she said it out loud. Home felt like hell. The doctor typed into the medical record, "Patient reports domestic stress," and moved on to the next appointment. The last time Claudia came in, she seemed worse. Sunken eyes, voice cracking. She said life had become unbearable, that she couldn't take it anymore, that she wanted it all to end. The doctor listened, took notes, but even then, there was no formal notification of violence. A few days later, Claudia's name reappeared in the system, but not at the local clinic. This time, she was at an emergency room. Claudia had multiple fractures caused by her husband. But what if we could see violence before it happens? What if we could listen between the lines to stories like Claudia's that often go unnoticed? We can. We can do it by combining artificial intelligence and linguistic analysis. We've developed a method that reads medical records in a whole new way. It identifies patterns that point to risk of violence, even before there's an official notification. It turns the words in a medical record into information that can save lives. We start by processing the notification data of all women who suffered violence in a given area. That allows us to find what we call day 0, when the violent episode was officially recorded in the system. Data shows that, on average, women die 30 days after a notification of violence is filed. Using AI, we can go back in time. We can track what happened before day 0. And what we found is striking. In the 90 days leading up to day 0, the number of medical visits increases. But there's more. Linguistic analysis shows a rise in mentions of alcoholism, anxiety, and psychological distress. These signals increase, sometimes up to 10-fold compared to the general population. At the same time, mentions of chronic conditions like diabetes and hypertension drop. It's as if violence starts to take up the space of healthcare. Our method reveals what was invisible. It shows the real scale of underreporting. It helps us understand who these women are, where they are, and when the risk begins. And it gives us time. We can detect signs of violence up to 3 times earlier than the average notification time. Violence doesn't always come screaming. Sometimes it whispers in the smallest details. Our mission is to listen to those signs and to turn words into protection, into time, into life.